In today's video, I'll be taking you through some treatment and management options for your patellofemoral pain. And do make sure you keep watching until the very end of the video, as I'll also be discussing some adjuncts you can try alongside the gold standard treatment, whilst also discussing what the evidence tells us you probably shouldn't do if you have patellofemoral pain. And we're going to start right now. If we haven't met before, then welcome to Genuine Physio. My name's Luke and I'm a senior musculoskeletal physiotherapist from the UK. If you would like to know more about patellofemoral pain and all other things pain and rehabilitation, then consider clicking that subscribe button and tapping the notification bell so you get notified every time I release a new video, which I do every single week. One of the principal reasons that we get patellofemoral pain is because of some sort of change in load. And this has to be priority number one with regards to trying to reduce your symptoms. We're going to find it very difficult to decrease your pain with the other adjuncts that we talk about a little bit later if the load management side of things is not addressed properly. Now, with regards to changes in load, it's normally because of two things. Either you have increased your level of physical activity or exercise too quickly in a short period of time, or it could also be due to weight gain. If we are talking about load management with regards to physical activity or exercise, we can consider frequency. So you could try and decrease the amount of times that you are completing that physical activity during the week. So it may be a case of, for a short period of time, dropping down from 4 times a week to 2 times a week. You could also consider the duration that you're completing that physical activity for. If you are at football training, which is normally an hour and a half, it might be that you could tolerate 45 minutes. If you are a runner, it might be that considering dropping your mileage down for a short period of time could also facilitate some decrease in pain. Again, considering runners, you may want to have a think about your speed. The slower you go, the less stress or load you have going through your patellofemoral joint. So it might be that you can maintain your mileage, but you do it slower for a longer period of time. Another thing you might want to consider would be the terrain. If you've gone from running on a flat surface to lots of up and down hills, downhill in particular is going to put more stress on your patellofemoral joint, it might be that you can adapt this in some way to help reduce your symptoms. Now, even just managing the load very well might reduce your symptoms to the point where they resolve and you can then gradually increase the load again. If this hasn't happened, then you may want to consider some of the other things we talk about a little bit later. If that load has changed because of an increase in weight, then that is going to have an effect twofold. Firstly, it is going to put more mechanical stress through your patellofemoral joint. Secondly, we know that if you have more fatty tissue in your system, you are more likely to have chronic low-level inflammation. And obviously, inflammation is not good news for joint, muscle, or bone health. So if weight is an issue, it does need to be an integral part of your treatment plan. Now, the other thing that we need to be prioritizing above all of our other treatment options is some sort of rehabilitation program. The strongest evidence that we have available at the moment suggests that we should be thinking about what we've already discussed, plus some strength exercises for our quadriceps, glutes, and pelvis. Now, I am going to do a whole separate video on rehabilitation for patellofemoral pain, but a few exercises that you may want to try would include some squat type patterns, step up type patterns, split squats or lunges, deadlifts or single leg deadlifts, and maybe some bridges or single leg bridges. In order to be conclusive about whether that rehabilitation program has worked or not, we need to ensure a few very important factors. Firstly, has it been done for a long enough period? We're really thinking about a 12 to 16 week rehab program. The second thing you want to make sure is that during that 12 to 16 week period, your rehab has been progressed. Your program should look quite different in week 4 and 6 to what it looked like in week 1 as your muscles adapt and change and as you find things easier. So there should be progression throughout that 12 to 16 week period. Thirdly, consistency. So the 12 to 16 weeks needs to be done consistently, probably 2 to 4 times a week. If you have had a week or 2 off at various different intervals, then it is likely that you need to do that program for a longer period of time. The fourth thing is it needs to be hard work. It needs to be a challenge. The idea is we're trying to stress these muscles to cause adaptation and change. So when you're doing it, you should feel like you've done a leg day at the gym. Your legs should feel a little bit like jelly by the time you've finished, obviously without flaring up your symptoms. If you are finding the exercises you've been given quite easy and you don't feel like they're doing much, the chances are they're not and you're underloading yourself. If this is the case, you're unlikely to see much improvement in your symptoms. The other thing that there is some stronger evidence for is the use of anti-inflammatories, if you're allowed to take them, of course. So if you do find that your symptoms are quite irritable, they're starting to get in the way of daily life, then some over-the-counter anti-inflammatories, if you're allowed to take them, could be considered. Now, I did say at the beginning of the video, if you stay tuned until the end, we would discuss some adjuncts that you could try alongside the gold standard of treatment, plus a few things that the evidence doesn't really support. So the recommendation here is that you do them in conjunction with your activity modification, your load management, and your rehabilitation program. They are likely to be far less effective if done in isolation. Now, there is some evidence for gait retraining, although this is quite a difficult thing to do, and it's definitely advisable to try this in conjunction with a biomechanist, a kinesiologist, or a therapist who can have a look and analyse your gait. One thing that you will see done quite a lot for patellofemoral pain is taping. Now, the idea here is that you put some fairly strong tape at various different points around the knee to offload that patellofemoral joint whilst you're moving around and doing your daily activities. Now, this is something that you could try yourself. There are various different videos on YouTube to try and show you how to do it at home yourself. But if you felt like it's something you needed some support with, then it's obviously always a good idea to check out a local therapist. Orthotics are another thing that could be used in conjunction with the gold standard treatment, and the idea is very similar to the tape. Typically, you would use an orthotic that has a slight heel raise, which will help offload the patellofemoral joint, and probably also a medial arch, just to decrease the amount of pronation going through the ankle whilst you're moving around. Now, just like the gait retraining, changing your biomechanics long term is quite a difficult thing to sustain and maintain. So it might be that orthotics are appropriate if your symptoms aren't responding that well to the rehab, or just having them at the beginning to reduce your symptoms and then gradually wean yourself out of them as your symptoms improve. Now, if you had tried all of these things for an adequate period of time and unfortunately your symptoms were still persisting, there is some evidence to suggest that even psychological intervention could help in the form of cognitive behavioural therapy or CBT. If that didn't work, you also have the option of more invasive interventions like a steroid injection or even surgery, but it's important that these are always last case scenarios and they should never be the first line of treatment. We did also mention that we discussed things that the evidence does not support the use of for patellofemoral pain. One of the first things, surprisingly, is manual therapy. So deep soft tissue massage or any other massage for that matter is not supported in the evidence. Other things would include EMG feedback, therapeutic ultrasound and laser treatment. So if you are getting offered some of these treatment interventions by a healthcare professional, it might be a good idea to look elsewhere. Thank you very much for watching. I do hope you found today's video useful. I would love to hear from you, so please do drop me a comment below the video and let me know which treatment interventions from today's video helped you manage your patellofemoral pain. If you are new to the channel, then please do consider hitting that subscribe button and tapping the notification bell. It means you'll get notified every time I release a new video, which I do every single week. It also means that more people are likely to see this video, which hopefully you found helpful. If you did find this video helpful, there's every chance you'll like the video that I did on how to diagnose patellofemoral pain at home and what it is, and there's a whole playlist on the channel to help you manage your patellofemoral pain better. Thanks again for watching, and until next time, I will see you again very soon.